Hi, my name is George John and I'm here to present the topic Remote Health Monitoring System. This is how I structured my presentation. First, we'll have a close look on the system Remote Health Monitoring. Remote Health Monitoring, like the name implies, is used to provide distant medical care for patients by integrating the structural and tracking systems. By structural, what I meant is how the electronic devices are linked together for an effective communication between themselves. And the tracking system that we use is a GPS system to find out the location of the patient. By taking the advantage of this system, we can develop a beneficial system to provide health care for elderly people, people with mobility issues and chronic diseases. Obviously, this system is really helpful for doctors since they can refer the data of their patients sitting in their home or in a room in the hospital. So, the question arises here is, why do we need a remote health monitoring system even though we have a much advanced medical facilities? The problem with the medical facilities that we get now is they are very costlier. So when we use the remote health monitoring system, the expense that we put on for clinical observation can be avoided. Another main advantages of using remote health monitoring is that we know the older population is increasing. So when we attach this remote health monitoring system, they can verify their data, like the physiological data themselves, and it is transferred to their doctors. It also make advantage when the lower. It can also use to avoid the problem of low doctor to patient ratio. So now I would like to put some light on the technical aspects of remote health monitoring system. A remote health monitoring system can be classified as a contactless monitoring system and a wearable monitoring system. In contactless monitoring system, we make use of our radio system and radio facility and camera. The problem by using this system is that it affects the privacy of the patient since we are using a camera for monitoring the health issues of the patient. Another disadvantage of using a contactless monitoring system is that it can be used only in indoor. So in order to overcome this problem, we'll focus or we'll study more into wearable monitoring system, which uses different biosensors to get the health data or health information from patient's body. Compared to contactless monitoring system, the advantage of using a wearable monitoring system is that it can be used both indoor and outdoor, or basically it can be used anywhere where there is an access to internet. So therefore, the importance of wearable monitoring system in present scenario is a questionable one. The main advantage, other than it can be used in indoor and outdoor, is that it can be used to monitor the physiological data or the health data continuously of a patient, like I said before. When we monitor these data continuously, we can detect any health disorder of the patient. Many researchers have pointed out the importance of knowing the disorder at earliest to avoid the chronic diseases like cancer. So if we are able to find out these disorder symptoms at earliest, we can give the treatment at the right time and we can avoid these diseases. Now I take you to the architecture of wireless remote health monitoring system. That is our main focus. A wireless health monitoring system is a three-tiered system with tier 1 is a data generation system, and tier 2 data transmission phase, tier 3 data storage and access. In data generation phase, we'll collect the data from all the biosensors connected to the body of the patient, and we collaborate these things and we'll send to the access points, which can be a smart device like smartphone. In the smart devices integrates these data and transmit this data to a medical server, which is where these data are stored. To transfer this data, we make use of technologies like 3G Wi-Fi. In the tier 3, like I said, it stores the data of the patient, and this data can be accessed by the doctor for sitting in a medical center. So main issues that can arise by using a wireless body area network, that is WBAN, is that since this is a wireless one, there will be issues like security and reliability, computational overhead, storage efficiency, and energy efficiency. In order to overcome these issues, we have designed a system that is more reliable, secure, and more energy efficient. So this is the research design I come up with, which you make use of the anonymous authentication method and adaptive transmission protocol. What is an anonymous authentication system? An anonymous authentication system consists of 3 components, like WBAN client, which is the patient, and network manager, which is a third party, secure third party, and an application provider, which can be a medical server located in a hospital. How this system works is like the network manager, which is a trusted third party, will give the system parameters and security key to application provider, that is, like I said, is a medical server. So in order to connect the WBAN, that is the patient and the medical server, the WBAN, the client has to register with the network manager, and after registration, the network manager gives a security key of application provider. When this security key is accessed by the client, it will authenticate with the application provider, and vice versa. The main problem while using this system is the energy efficiency, since we got a lot of biosensors attached to the patient. In order to overcome the energy efficiency problem, we make use of adaptive power transmission control protocol, which basically make use of periodic motion movement of the patient. We attach an accelerometer with the patient and find out the periodic movement of the patient. Periodic movement is accessed, and the transmission takes place only when the link is ideal to transmit. Even though it has many benefits like energy efficiency and storage, everything, security, the main limitation of this is the delay in transmission and the cost of implementation. Like we use 2 servers, so the cost of implementation is more. Now I would like to conclude and put some recommendation to my idea. Like I said, the system was able to transmit the data securely and efficiently, but there is this time delay in transmission. So if we overcome this delay, the system becomes more efficient.